Hello, I am Susan Lowell. In Connecticut, I have a private practice specializing in the diagnosis and remediation of reading disorders, including dyslexia, and provide educational evaluations, consultation, advocacy, and professional development for teachers. In addition, I'm an instructor here at Bay Path University in the Reading and Literacy Instruction program, where I teach a course on reading research and a course on reading and writing assessment. As a previous vice president of the International Dyslexia Association, I was lead author on Basic Facts About Assessment of Dyslexia, Testing for Teaching, and authored the fact sheet entitled Dyslexia Assessment. What is it and why is it important? I am unable to be with you today because I'm out of the country, but would like to share with you some important facts about dyslexia. Dyslexia is common, affecting as many as 1 in 5 who are bright and struggle to learn to read. Research shows that additional direct systematic instruction, provided early and appropriately, can help all but the most severely impaired students catch up to grade-level literacy skills. When students do not make adequate progress with early intervention, clinical assessment by a skilled professional at the public school is the next step in identifying those students who continue to struggle. Evaluation by a medical doctor or neuropsychologist is not required for assessment of literacy problems or dyslexia. As Emily stated, the key symptoms of dyslexia are problems with decoding or reading accuracy, reading fluency, and spelling. If fluency is weak, comprehension and vocabulary development can suffer. Students who cannot spell will have difficulties with writing. Phonological weaknesses, including problems with phonological awareness, phonological memory, or rapid automatic naming, form the language-based weaknesses that cause dyslexia. The problems associated with dyslexia are language-based, not visual, and not related to weak cognitive skills or lack of intelligence. Dyslexia has always been listed in every federal special education law under the category of specific learning disabilities called SLD. Public schools must identify dyslexia when appropriate. Areas to assess when dyslexia is suspected include phonological awareness, phonological memory, rapid automatic naming, receptive vocabulary, phonics or sound symbol skills, decoding real and nonsense words, oral reading of sentences and paragraphs, reading fluency, reading comprehension, spelling, writing sentences and paragraphs. Math skills should also be assessed. All testing must be research-based, normed, reliable, and valid, generating standard scores and percentile ranks to compare students to peers. A written clinical report will summarize all history, referral questions, and test results, and will give a diagnostic statement when appropriate. Testing for teaching is the goal. If the student is identified as a student with dyslexia, recommendations will be made in the clinical report for specially designed instruction, together with accommodations and assistive technology supports. Assessment should drive instruction. Dyslexia treatment is educational. School teams, including parents, will meet and consider all data, including test results. When appropriate, they will generate a special education plan under the label of SLD and dyslexia. Student progress should be monitored using reliable and valid assessments. As students continue their school careers, ongoing educational and family support is needed to meet increasing academic demands. Students with dyslexia need updated educational testing to provide required documentation for needed accommodations in colleges, universities, and in the workplace. For more information, please see the International Dyslexia Association's Basic Facts books and the fact sheet on dyslexia assessment. In closing, I would like to thank Emily Hanford for her brilliant investigative journalism reporting. Emily's work has shed light on the prevalence of literacy problems, the importance of teaching teachers about evidence and the science of reading, and the structure of language, and the urgent need for high-quality literacy instruction for all students. Thank you.